every Thursday such as this, we have medical practitioners, those that are around the medical space, helping us to have understanding to different health conversations. Today on the issues this morning, we will be talking about conversations that has to do with medications, right? So when we talk about some illnesses, when we talk about prescriptions, when they come up, definitely you would see that your doctor sometimes will tell you, oh, this is the kind of drugs you will take, this is the medication you have to go through. What exactly does antimicrobial means, right? And then what are some of the causes, and then the resistance, and some other conversations around it. So I'll crave your indulgence to stay with us from now up until 12 p.m. while you will be learning, and of course I will be learning too as well. You know how we do it on the show. The studio lines will also be made available for those of you who would like to ask questions from our lab scientist in the studios today in person of Mr. Lawal. So if at all there are questions, you can do well to call the studio lines on 0904-081-1061 or 0904-082-1061. My name is Okpeyemi Adebambo. And on that note, before I start off with my questions, I would like to first of all say good morning to you, Mr. Lawal. Thank you for joining us.
Good morning.
It's good to have you in the studio.
Yeah, it's lovely having you.
Thank you very much for joining us. I'm aware that you have a lot to do, but then you still had to squeeze out the time to join us in the studio this morning. Nigerians can hear your voice. Okay. Lagosians can hear your voice. The good people of Ikorodu can also hear you. Yeah. And they are all hoping to learn from the conversation this morning. I'm also hoping to learn from the conversation. So I believe it's going to be a beautiful conversation. Our focus this morning, Mr. Lawal, is antimicrobial resistance. Exactly. Before we even talk about the whole antimicrobial resistance, can we start with the word antimicrobial? What does that mean in itself?
Yeah, thank you very much, and thank you for having me.
It's good to have you, sir.
And the listener, good morning to everybody. Well, antimicrobial is an agent that kills bacteria or inhibits the growth of bacteria. Those are the antimicrobial, and these are they are in form of drugs. We have antimicrobial medicines. You know, an example is antibiotics, antiviral, and so on. So that's antimicrobial.
You know, there are a lot of, thank you for that clarification, sir. There are a lot of misconceptions around this antimicrobial resistance. Some will tell you, oh, if you've used a particular drugs for too long, it will no longer function in the body. Some people will tell you, oh, my own kind of body system does not even work with antibiotics and all that. All of these things, one after the other, you would help us understand them. Let us also now talk about some of the major causes of antimicrobial resistance. What causes it? How does it happen?
First of all, I need to also tell us what antimicrobial resistance means.
Exactly. Thank you.
This is acquired ability of microorganisms to resist chemotherapy agents. Chemotherapy agents are antibiotics, antiviral, you know, as we said the other time. So they resist it. The organism, you know, for example now, they mutate, you know, as time goes on. These are some of the things we want to discuss today, which happen to be some of us are responsible for organism trying to get over, you know, trying to prevent drug to, you know, to affect them.
To function.
Yes, to function very well. You know, so they are resisting drug, you know, and that's what we want to discuss. So what makes them to resist drug? You know, for example now, improper, when they prescribe, when the patient refuses to follow the prescription.
The proper prescription.
Yes, and then overuse of antibiotics.
Overuse of antibiotics.
Yes. You know, so as time goes on, the organism will design a way of, you know, preventing the drug from affecting them. How do they do that? They don't allow the drug to penetrate. They eject the drug. You know, so therefore there is a failure of treatment. So how do you, like me, I'm a medical lab scientist, and what made me, you know, to want to discuss on that, because we see it live. For example, when the doctor make a prescription, when the doctor make a request for test in the laboratory, let's take for example urine test.
Okay.
So doctor will say go and do urine MCS. Urine MCS means microscopy, culture, and sensitivity.
Okay.
So microscopy means we want to check the urine. What are the organisms in the urine? like bacteria and all that.
Mm.
So during the microscopy, if the urine contains organism, we will see it. Not only
In the
that,
urine?
yes, we'll see in the urine. That's why it's only in microbiology you see all this microbe life. So apart from that, we use microscope to see it. You understand? Then we now do what we call culture. Culture means, for example, now if you put sugar on the table,
Okay.
what do you think will happen to the sugar?
Ants would come.
You see ants will come. So we have food for all these microorganisms that we call agar. So we put that urine in the agar, whereby the host organism will now come out. You understand?
Aha.
We culture it for 24 hours. So that is why we're able to see the organism live with our naked eyes. So the last part of it is now to do the sensitivity.
Aha.
Sensitivity means the drugs that will be sensitive to those organisms. You understand? And the one that it will resist. So, but the growing thing now, what we used to do, when we do sensitivity like that, we see a lot of drugs that are sensitive to it. So it will be easy for us to tell the doctor that these are the drugs that are sensitive. So the doctor will just make prescription on those drugs and it will work. But nowadays, we are seeing a lot of resistance.
A lot
of resistance coming up. In fact, there are some popular drugs. Well, I will not mention a particular.
Yes, please don't.
But we know some particular drugs. They prescribe a lot. Unfortunately, when they come to the laboratory, those drugs will resist. Will not be sensitive. You understand? And those are the reasons why government is now working on drugs that are sensitive, and what makes organism to resist. You understand? Those drugs. And that's what we call antimicrobial resistance.
Mr. Lawal, obviously we have a lot to talk about this morning. Yes. We have a lot to talk about. In one of the things you said that people overuse drugs. I want us to clear that aspect. For me, I'm already thinking in my head that overuse of drugs could be, maybe a drug the doctor prescribed. I don't know if you've seen people that they will say, use 2 of these, maybe for painkiller, and they feel like, I want to quickly be fine, I want to get healed quickly, and then they use 4. Is that what you as a lab scientist call overuse? Or, use this drug from Monday to Friday, and they continue using till around Sunday? How best can you describe overuse of drug as a lab scientist that you are, sir?
Yeah, what we call patients are very funny. You understand? When doctor prescribe, like I said, doctors don't just prescribe. In the general hospital, they will make sure your sample gets to the lab. And that lab work is to tell them the particular drug that will deal with that particular ailment. You understand? So once they prescribe once, you understand, and the patient is able to get that drug, they will not, if they're having another maybe issue or another, they may not want to go back to the doctor again. They will not continue to be using that drug. You understand? Meanwhile, it might be another drug that will take care of that ailment. So they as a result, they abuse it, overuse it, continue, they will self-medication. That's what we call overuse.
Self-medication.
Yes. So instead of going to the proper hospital, where the doctor will attend to it properly, because we work in the hospital, as a team. Everybody will do his own part. Even the pharmacy will do his own part.
Every department is connected.
Yeah. As we have for antibiotics, we also have for anti-malaria. From my own experience, people are giving anti-malaria drug and it was not working. They have to come back to because they did not do what they're supposed to do. When they come back to the lab and we'll do the test for malaria again, we'll see the parasites are still there.
They're still there.
Before they now, okay, they will change drug, because the normal thing is to change drug and the person will get well. You understand? So, but it's really, most of the time, it's antibiotics. You understand that all these organisms are avoiding, mutating, and get over them. So it's called, most of the time, treatment failure.
Treatment failure.
Yeah, and you see that constant infections. So it's not because, it's because of resistance of these organisms.
Thank you, Mr. Wale, for that one. If you're listening to us, Mr. Lawal, apologies. If you're listening to us this morning, we are talking about antimicrobial resistance that is gradually becoming at the order of the day now. It is becoming too rampant in our society. This has to do with the abuse of drugs. This has to do with self-medications. And we have a lab scientist in the studio here who is helping us to understand areas to this. I want us to look at some myths, some assumptions, some commonly practiced behaviors when it has to do with medications by patients, because I know you have seen a lot, you have heard a lot with your kind of job. But let's first differentiate, because the thing you're saying now, in my head, I'm trying to differentiate between antimicrobial and antibiotics. Are they the same, or is it different? Are they different?
Though, like we said, antimicrobial agents. Antimicrobial is agent that kills or inhibit the growth of bacteria. You understand?
Yes.
So we use antimicrobial. That's why I said this antimicrobial, they have medicine. So you understand? So most of the antibiotics are, and from antimicrobial.
Okay.
So,
okay.
and it's based on category of the organism they want to use it for. You understand? We also have antiseptic and all that. All these are to prevent the growth of bacteria, or to prevent the growth, or to kill outrightly. You understand?
Yes.
So it's from antimicrobial that they will say antibiotics, antimicrobial. That is, anti means against the microorganisms. You understand? It's from there the drug, they make the drug that are antibiotics that will kill the organism.
Thank you.
So antibiotics are just the drug.
The drugs
from antimicrobial.
Haven't clarified that, Mr. Lawal. Let's look at some of the things that we do. I want to include myself too now. A lot of people do when it has to do with drugs. Let's start up with this common saying. Some will tell you that, oh, this particular drug does not work for me. Antibiotics, they'll say it doesn't work for me. I know the one that works for me. And like you rightly said, we should not mention names so we don't do free promotion for them. They did not pay for promotion, right? So let's imagine antibiotics A works for this person. But this other person here says the same antibiotics A does not work for me. What happens in that situation?
Yeah, that is where laboratory comes in. And that's why I'm here. That it should not just when doctor does not go do the proper thing by making request to the laboratory that I want to know the particular drug that will work for this patient. Because in the laboratory, that's like I said it in the beginning, microscopic culture and sensitivity. And sensitivity part is to be able to tell the doctor the drug that will work for A and the one that will work for B. As well, those drugs are directed on that organism that is causing the trouble. And in the laboratory, we have immense drugs that we put directly on the organism in the sample. And we see it physically. By the time we culture it for 24 hours, you will see the drug dealing with organism and you look at it live, because you will see the zone of inhibition spreading live. So this is different type of drug. We have the gentamicin, we have different drugs and the way they behave with the organisms. You understand? So you see it live and you'll be able to say, in fact, there are different zones of inhibition in the laboratory. We have what we call 1+, we have 2+, we have 3+. You understand? For different organisms. So we pick the 3+ because that one, maybe after 1 or 2 days, say by the time the patient take it, the patient will be okay. And at the same time, 1+ also works. There are times whereby doctor will have prescribed a drug and it will, it will not work, it will be resistant and all that. But later when they also, okay, let's check what the laboratory say, it might give us just 1+. By the time they, for example, if somebody is wounded now and they brought the wound swab, and you take that particular drug that laboratory recommends, in few days the wound will dry off, because we are telling you the particular drug.
So that it's precise
for the organism that is making the patient to have problem. You understand? So because what is happening to this one is different from what is happening to this one.
True.
The causative organisms are different. We have organisms like E. coli, Staphylococcus aureus. Mention it. You understand? For example, in the urine now, the most implicated organism in the urine It's E. coli.
Mm.
Even though we are outside the south staff or staff, it's not. It's E. coli, 80%.
Mm.
You understand?
Mm.
So when we now isolate it in the lab and we put it beside drug that will work for it, we will see that this is the proper drug. But if you don't have lab to have a say by checking drug for you, it will not work for you. You know, there be a kind of like I said, there are some drugs that I know that they are not working again. The laboratory has shown us that this drug are resistant, and we have some that are still sensitive. For example, now some organisms now are multi-resistant. They call them superbug. Those superbug are the fear of WHO. They are the fear of WHO now because every surgery in the hospital will require antibiotics. You cannot imagine when they do CS for somebody and they prescribe antibiotics and the patient does not get well. So it allows longer stay in the hospital, cost more. You understand? So that's why government is doing everything. Part of what I'm doing now is awareness.
True, correct.
You understand?
Correct.
To make people know that all these organisms are getting their way out. They are preventing. They are no longer allow drug to kill them. You understand? So there are so many research going on.
Thank you, Mr. Lawal. I want us to talk about two categories of people before we then talk about the dangers of these situations that we find ourselves in. Let's talk about those that first off they do self-prescription, right? Oh, I know my body system. If I just go down to the chemist there, that's what I used last 2 months. And when I just bought these antibiotics, I bought that one, I mix it with this one and that one. It worked for me. And you even see that they still come out affirmatively to tell you that it works for them. But with what you are saying now, obviously, it's important that before prescription, there should be a lab test. And you have confirmed it that doctors also do that. They send these people to you, you have the lab test before there will be medications. But these people, they don't go through lab tests. They don't go through the right channel, but they claim that, oh, it's working for me. What do you have to say to a situation like that?
Those are the people that are causing the problem on ground, that are making the microorganisms to be wise. You understand? Because they mutate. They get into mutation and prevent because some of these drugs we are saying, they used to be sensitive. You understand? But as time goes on, they stop being sensitive, they become resistant. You understand? That's why we said acquired ability of microorganism to resist chemotherapy agents, which are drugs. They acquire it suddenly. They've been sensitive to it before. So, but when somebody is self-medicating, you understand, without going to through the proper channel, they are the one that it's good for me. I can use it. It's working for me. And you are abusing it because you are not using the proper drug. It might work for you today, but later you find out that it's no longer working for you.
It's already used to the system.
Exactly. So the proper thing is to see your doctor. The doctor make a good. They will ask what sample. Is it urine? Is it wound swab? Is it air swab and all that? Definitely they will ask you to go and do MCS, which is microscopy culture and sensitivity. The last part, which is sensitivity, has to do with what we are talking about today, because that's where even the pharmaceutical companies come to the laboratory and say, oh, we have drugs for you, help us check it, so that the doctor will know that our drugs are working and use it as to prescribe, and we collect it to use. So we tell them, this is the drug that is working more, this is the one that is not working. So those are the things we do.
And let's talk about, thank you for that, Mr. Lawal. Let's now talk about another set of people that for them, I think I've done that before too, right? Using antibiotics could be, I don't know how to put it. You just feel like, oh, consume 4 at the same time, consume this and all of that. And then you feel like, oh, the prescription tells me that I should use it for 4 days. This hour to this hour, this hour to that hour. But they too already feel good. They too already feel like, oh, I'm feeling well already. And most people don't see any reasons to why they should go back and complete their dosage. Now, let's talk about those that don't complete dose and they claim, oh, I feel well already. In that situation, sir, do you think there is a problem? Because this person did not finish the dose, but he's already hale and healthy, he's bouncing back again. Is there a situation with that too?
Yeah, those are the antimicrobial. Those are the driver for antimicrobial resistance that we are talking about. You understand? If doctors say take this so time and all that, it needs to be followed strictly because there are mechanisms of inhibition. You understand, by microorganism. What do? The cell wall, they inhibit the cell wall, preventing it from growing. They inhibit the protein synthesis. They won't allow protein to grow. They inhibit the metabolite, all these metabolite. You understand? Thereby preventing and some drugs kill the organism outrightly. You understand? So, and it is on stages by stage. So now they say you should take 2, you take 4. You say you take, so you're already affecting the in vivo issue of the organism. So those are the best thing is to follow proper. There are some people maybe after getting well 2 days there will be leftover drug.
Exactly.
Another person will go and pick it. Those are the drivers of antimicrobial resistance.
In fact, sometimes they go back to the drugs maybe after 2-3 months, they start feeling sick again. And they just feel like, instead of going to the hospital, at least I use this one, it's a leftover from.
That is the abuse we are talking about. That's what we don't want people to be doing again. They should help the researchers, help the scientists, help medical practitioners, and help ourselves, because once you are not okay, you see the doctor, they prescribe drug through what they saw in the lab, and you get better. So because it's rising.
Thank you. The reason why you're here today is to create awareness, like you have rightly said, and that is exactly what we are doing. Now, from your experience so far, these are some of the little things that I know happens, especially when it has to do with antibiotics. But from your experience so far, can you also help us understand some of the, should I say, common mistakes that people make, your patients, common mistake that people do when it has to do with prescription, when it has to do with drug usage? What are some other common mistakes? Maybe for the benefit of those that are listening, they will know that, oh, so this thing I've been doing is actually wrong. I need to stop doing them. Can you help us understand some other common mistakes that has to do with medications?
Well, a common mistake I can talk about is that when particular doctors don't have time to send the sample to the lab or send the patient for proper tests, it's a mistake. To do the proper thing. There are a lot of abuse of antibiotics. So,
sir, are you saying that we must always go through the lab test first before prescription?
Talking about, what we are discussing today is about antimicrobial and also antibiotics.
Yes.
You understand?
Yes.
And if you are having, for example, it's not all the tests.
Okay.
You understand?
Okay.
You are having some problem with your urinary tract infection, ear infection, anything infection at all, you have to pass through laboratory to diagnose the test. You understand? And also get you the proper drug that we use for that particular test. So you have to pass through.
You have to pass through.
Yes, and of course, I have not seen any ailment that make you not to pass through laboratory if you really want to do the proper thing. You understand? If you're having infection, if you're having fever, if you're having, we tell you. But another problem we see, we normally have common colds around. There are common colds. You understand? Like if somebody sneezing, having, so people resort in taking antibiotics, which is wrong.
I was going to ask that for as cold, catarrh, malaria, they just say, oh, it has to be antibiotics.
No, this is viral. You understand? Common cold is viral. It has to do with viral. It doesn't have to do with antibiotics. So they rush up to go and be taking antibiotics instead. And most of the time, they are reacting to the weather, of which you need to take, of course, some particular drug. I don't want to mention particular drug.
Yes, please.
People will not go and be abusing it. The proper thing is to go to the doctor and get the.
And moreover, the system differs. It might work for you in this way. It might not work for this other person.
Because they will ask you, what is happening, how it's happening, when it starts, and all that, before they make proper judgment on you, of which you have to pass through other team workers in the hospital. So finally, you get back to the doctor and they give the final decision.
Okay, very well then. Maybe you should go ahead. I think you were still saying some other common mistakes that we make as regards medication. Then I think there are people too, when you talk about people who decides to say, oh, this drug, you can also use it. Now, I want to talk about genetics now, right?
Okay.
Because I know that as a lab scientist, the role of genetics also has a major role to play,
Yeah.
right? So, because this person is my father or this person is my son, and then I know that we have the same blood running through our veins, and this particular antibiotics is medicine A. Let's just use that, right? So it works for my father. Can't I also use it as a son?
Yeah. Talking about genetics,
Yes, sir.
we have something we call pharmacogenetics.
Okay.
It has to do with um, particular drug for particular person.
Mm.
And of course, it's not really yet ripe in Nigeria, it's well abroad, whereby you do genetic tests
Mm.
to know whether that particular drug is for you, is for your gene.
Mm.
You understand?
Mm.
But it's not yet rampant here. What we still do is people, for example, now you want to go to counter and buy drugs. You cannot buy paracetamol, for example, may not be for everybody. You have to do genetic tests to let them know that this paracetamol will work for your own gene. You understand? In those advanced countries, that's what they do now. Pharmacogenetics, they will check your genetic constitution before they give you drug. Because and the reason is side effects.
The side effects.
For example, now if somebody for example, that time when people are taking quinine, taking all that, they normally have side effects.
Chloroquine and the like.
If you do genetic tests, they will know that this one will not affect you. You will not have side effect about it. You understand? So that's the aspect of gene that you are talking about.
How dangerous is it for people to go through self-prescription and all this other, talking about this microbial resistance, right? When the body has refused to adapt to these particular medications anymore, what are some of the dangers? The reason for this question is because some will feel like, see, all that thing that Mr. Lawal is saying right now, some people listening to you right now might say that, oh, what he's saying is just his own jare, at least I've been living fine. What are the dangers? What happens after?
I've said it when we started, there's going to be treatment failure.
Treatment failure.
Multiple infection, constant infection and all that. When you don't follow the right thing, maybe you treat yourself today, get well, another time you still start feeling it again. Because the organism you are trying to kill what is happening to you. And those are the organisms we see in the lab. You understand? And that organism you are trying to treat has mutated. The drug you are taking is no longer affecting it. You understand? So, it's resisting that drug consistently. Because you have abused it. You have overused it. You understand? And that's what we are saying about antimicrobial resistance. If the public are aware, like the way your station is telling public now that we are not supposed to be doing this. So they are helping the researchers, they are helping the scientists to prevent antimicrobial resistance.
How about the role of hygiene now, right? Because we see that please allow me, we are going through many sides. I'm looking at every possible means, right? Do you think hygiene is also important?
Very.
For instance, somebody who has been given the opportunity or asked to take up a particular prescription, a particular antibiotics, and then what's the role of hygiene to medications?
Yes, poor hygiene is also a problem. You understand? Poor hygiene, for example, now malnutrition normally help organism to penetrate. You understand? We have, no matter how you bathe in the morning, you have organisms that surrounded us, that are in our body.
Even after bathing?
Even after bathing, but we call them residential organisms. They are living there. You are living, they are living, no problem. But if there is malnutrition, they will have opportunity, because we have immune system that's supposed to prevent this organism from getting into us. So if there is malnutrition and immune system dropped, they will have opportunity of penetrating. If there is accident and there is a wound, the wound that has been on the skin before will penetrate. You understand? So look at, for example, E. coli is a resident of the stomach. It's living there normally. E. coli, we call it Escherichia coli. It's living there normally. But if it has opportunity to get to urinary tract site, you know how close urinary tract site to the stool, to the where we, you know, defecate.
Yes.
You understand?
Mm.
That's why people normally have toilet infection and all that, especially women. It's very close. You understand? So if the toilet is not well washed, or somebody just stood, and of course, there are some stood that you will not see. You think they have washed it properly. If it gets to urine area, it becomes problem. The person will not get well again because it has gone to an area that is not familiar with, which is urinary tract area. If it's in the stomach too, you can't feel anything from 0 to 5. 0 to 5 years.
Or it is okay if it is in the stomach.
It's okay if in the stomach. Coliform counts. They want to see whether the water has been it has a defecation, they have stool on it. You know, so they want to check those organisms because it's from the stomach. But it starts interest itself in the small baby. That's when, you know, all these pumping from 0 to 6 months and all that, you see them stooling. It's because of this E. coli that is trying to start living in our in the stomach. So as time goes on, they start living there. They won't cause any trouble until if you give them chance to now get to a urinary tract site. At that time, you yourself, you want to pass urine, you'll be having difficulty in passing urine. You understand? In fact, blood can be coming out because the E. coli that's living gently in the stomach, you know, and come out from the stool because they are always in the stool. There is no stool, you will not see E. coli. So you have allowed it to touch your urinary aspect, you will not be okay again. And those are the opportunistic pathogenic organisms we are talking about. You understand? You use opportunity to get to the urinary tract and start causing trouble. So, you know, that's why we say it's a major implication in the urinary tract infection because the two places are close. The stool area and the urinary tract area. So when somebody go to the toilet, you have to make sure the toilet is properly clean. In fact, use antiseptics to clean it, to kill, because it will inhibit the growth of those organisms or kill it outrightly before you now sit down on the toilet. You know.
Can we talk about, thank you, Mr. Lawal, can we talk about gender now? Does the gender also have a role to play when we talk about this antimicrobial resistance? Like, there is this assumption that, oh, as a lady, you are more prone to these infections or diseases, right? You have said that these things lead to some kind of infections at the end of the day. But then some will still believe that, oh, no, that is not the business of a man. Only a woman has more chances of... what do you say to that?
Antibiotic resistance does not have
anything to do with the gender.
Affect anybody, whether age, female, male, old, young, and all that. It has nothing to do with the gender.
It has nothing to do with the gender.
Woman can abuse it, men can abuse it. You understand? So
it's not like as if I'm a man, so I'm macho, I'm stronger.
It has nothing to do with the gender.
Thank you very much. The studio lines are now available 0904 081 1061 or 0904 082 1061. If it has to do with medications, drugs, right, prescriptions, you can do well to call the studio lines this morning as Mr. Lawal, who happens to be a lab scientist from General Hospital Ikorodu, would take your questions and, of course, answer them appropriately. Let's talk about solutions and preventions. When we started the conversation, like I always say, I said prevention is better than cure. You have said so much, you have said a lot as regards this, but I want to also believe that there are solutions, right? There is no problem without its solution, and there are no solutions without problems. Can we talk about solutions? Can we talk about preventions as regards antimicrobial resistance?
Yeah, one of the solutions is awareness.
Awareness, that's what we're doing already.
Yes, surveillance, more research as we speak. I have some of my colleagues, you know, doing genetic research on most of these microorganisms that are resisting drugs. You understand? And in fact, WHO has prioritized some organisms. You understand? On this, like I said, those that resist, they call multi-resistant, have been named as superbug. You understand? So all this identification, you understand, what the government and the world at large are doing to prevent this antimicrobial resistance. Because if all the drugs stop working, you can imagine.
There's a big problem.
Exactly. So there are, you know, those are the aspects of government. In fact, there are so many committees, NCDC, One Health, and others working seriously, on to prevent antimicrobial resistance.
Thank you for that one. I think I also want us to talk about the herbal side now. Right, it's important we talk about this. When we talk about the antimicrobial resistance, does it has to do with just antibiotics, medications? Do we say the English medications now? How about those that takes herbs, the ones that we commonly call the agbo? Does this also have anything to do with the
Yeah,
resistance to
yeah,
antimicrobial?
that common a lot, and to me, from my own, it's not right.
It's
It's
not
because
right.
they don't have dose, no dose. You just take it, and of course, the liver has to do its own part when it comes to toxic. Because most of these things, there is no one that will say does not have its own side effect. Even
Mm.
paracetamol has its own side effect. That's why the dose is there, so that it will not affect your liver so much. You
Mm.
understand? But when we take abo, we have seen situation whereby, you an elderly person who told us that he has never taken um, white drug and all these our drug before, but
Never.
has always been taking abo. But unfortunately, by the time we conducted test on him, we checked liver, we checked this and all that,
Mm.
they are all high.
Mm.
The test was so much. In 3 weeks, we lost the man.
Wow.
The man passed on because all this liver are already not working again. The organs are
Damaged.
failing.
Mm.
You understand?
Mm.
You lost the man.
Mm.
So taking herbal without prescription,
Mm.
taking oil without prescription is very dangerous. It's dangerous.
Mm.
So too much of it, abuse of it. For all of us, we grew up with herbal and all that. You understand? So, but some people abuse it as well.
Mm.
You can see that I like some herbal now that are also giving prescription.
Mm.
They are modernizing
Yes,
it. So
yes,
those are
yes. The tradomedicals.
exactly all those on.
Mm.
They are trying to make sure people are not getting down by taking the herbal.
In another 10 to 15 minutes, Mr. Lawal, we will be wrapping it up for this particular conversation. And of course, it's still about the awareness, talking about antimicrobial resistance. Let's talk about some signs and symptoms now. Right? I think with the way we have had this conversation, a layman out there might just feel like, oh, okay, this whole thing that they are talking about only occurs, this resistance is only when you discover that, oh, the drugs are no longer working for my body system. I've used this drug, I'm using it, and it looks like I'm not getting well. Is that the only symptoms or the signs? Are there any other symptoms or signs that people will see or one should look out for that, oh, if something like this start happening to you, if you start feeling this way, just know that you are battling with antimicrobial resistance. The drugs are no longer functioning.
Those are the major signs.
Mm.
Treatment failure,
Treatment failure.
multiple infections.
Mm.
You are feeling sick today. You take drugs to another 2 weeks. You're feeling so. The proper thing is go to the doctor who will request for the lab. There are some even in the world that they don't just give them drugs. They don't just prescribe. They go back to the lab and say, oh, what are we going to do? What is happening in this person's urine, in this person's wound, in this person this. So the lab will give them the particular drug for that particular organism that is causing problem for the patient. And once they do it, like I said, I mentioned the wound the other time.
Yes.
Wound, they are treating the wound. You understand? So they now send to the laboratory. Which drug can we use, for this wound to be? Immediately we do sensitivity and we came out with the drug that they are going to use. The wound dry off quick. So there is quick. People will get well on time. You understand? When they follow the normal thing instead of prolonged infection. But of course, in the laboratory, we conduct so many tests. We have chemistry department, we have microbiology department, we have hematology department. You understand? Each with whatever you bring to the hospital.
Before we go, Dr. Lawal, I don't know how you are going to answer this, but I want to place on the spot. I like to do that sometimes. Some people don't like to come to the hospital because of the financial side, right? And then we usually hear that, oh, when you go see a doctor, they will refer you to the lab. Like you have also said that it is the best practice.
Yes.
But we hear that the lab, you get there, they will tell you, you will do this test, you will do this test, you will do this test, and then before you start know where it is going on, you're already spending thousands of naira. I'm not telling you, Dr. Lawal, to mention, Mr. Lawal, to mention a specific amount, but if you are going to be sincere to Nigerians, is it truly expensive to visit a lab in Nigeria?
Well, what I can say is that if you refuse to visit, to go to the hospital, whereby they will send you to the lab, you understand, because you don't want to spend money, you end up spending more by self-medication or outside. Because it is whatever you tell the doctor. Oh, I have fever, I have this, I have that. So they will prescribe along what is happening to you. You understand? It's not that you come to the lab and do all the tests that will cost you more money. And besides, let me also tell you that people don't, nowadays, if you like yourself, you don't wait to get issues or you have infection or you are sick.
So it's advisable that you just go to the hospital, go to the lab and check yourself.
In general hospital, we have that aspect that we call wellness. You understand? Yeah, you just go, you are not having any issue. You just go there, check liver, check kidney, check everything. Then you have your, results.
You are a lab scientist, but they say sometimes that you people just come up with irrelevant. Okay, somebody comes now to say I have headache. You're saying go and check your liver, go and check your kidney. What do you have to say to that? Irrelevant lab checks. Is it true?
No, it's not. Like I told you, the request will come from our GOPD, the test. We are not the one that will make requests because most of the time lab scientists don't need to see the patient. All we need to do is your sample. You are at home eating, but your sample is still with us. We are still seeing you. You understand? So we don't need to, it will come with the form or come with the request. Whatever they request, do kidney test for him. You don't know why. Doctor must have known the reason why I sent for kidney.
All you need basically at the lab is the sample.
Is the sample and the request that will follow it. Your age or this thing and what they are suspecting. Those are the things we need. We don't even need to see phlebotomists, people that will collect blood and may even see the patient. They will send the sample in for microbiology, for medical lab scientists to work on it. So that is his request. It's not.
Yeah, but still, Mr. Lawal, you've dodged the question of either it is expensive or not. But you have said that it's important that we do these things. Yes, we know that. But then, is it a thing that a lay Nigerian or an ordinary Nigerian, let me put it that way? For instance, now with what you have said, and somebody who is listening to you right now feels like, oh, I love the way Mr. Lawal spoke on radio. As a matter of fact, you have convinced me too now, and I love the whole conversation. But then, my pocket also matters. Is it affordable, sir? For an ordinary Nigerian?
It depends on the problems. It's not only laboratory tests that we do in the hospital. Sometimes they might ask you to do scan. They might ask you to do the other tests that will make the doctor to diagnose properly. You understand? So when we are leaving laboratory, whereby we deal with your urine or whatever, you go to another aspect where you do tests too. So all those ones might make what is going to make it to be cost. You understand? But talking about laboratory, what you spend there, they are not, but depending on.
They are not ridiculous.
They are not ridiculous depending on the test. And of course, if you don't come, you spend more. And of course,
true.
You are killing yourself gradually. So like I said, some people don't even have anything. They come to the laboratory to check themselves yearly, some quarterly.
So it's advisable at least once in a year, just go to the hospital, have a proper check of yourself.
Over there in abroad, there are some tests that is recommended for people about 40 years old, doing it every 2 years, whether they have issue or not. Because the earlier they know about what is happening to you, the better they start commencing treatment. So that's why life expectancy over there is high. About 80 people don't just die. They get to 80, 90. UK is 90. Life expectancy. Now in Nigeria is 50 something and all that. So it's not because they are really better. It's because of going through the proper way. Check yourself, medical aspect. You understand? So it's
just 2 more questions and then we would.
I also need to tell you that we are professionally called MLS. MLS, Lawal,
MLS.
MLS.
Oh,
So
okay.
that's
I will
just
take note
like
of that.
MLS.
Apologies. Apologies. I will take note of that. MLS.
Yeah, MLS
That's
Lawal.
another title. The full
Yeah.
meaning of the MLS, please.
Medical lab scientist.
Aha, medical
Professional.
lab scientist.
Yeah.
Let's talk about General Hospital, MLS Lawal.
Exactly.
All right. Now, for somebody who is convinced with what you have said and it feels like, okay, I want to also go through this route, how does it work with General Hospital? When are the opening times? How do we come see MLS Lawal, or we would have to see the doctor first? For somebody who feels like, okay, I want to get myself checked, like you have rightly said. What's the procedure like?
Well, in public hospital, the first point of call is to go to GOPD.
Okay.
We have general practitioner doctors.
Mm.
Who, even if you are okay, they will advise you on what to do. You must get there first.
Mm.
You understand? So they will advise them. Okay, I want to check everything. Okay, no, because we have a particular area, wellness, and we have a doctor in charge. Eventually, they will bring you to the laboratory.
Mm.
You know, because that's what you want to come for. But
So the lab is not a place that we go to first.
No, you don't have to come to the lab first.
Mm.
If it is hospital.
Mm.
Yes.
Mm. We want to thank you very, very much. Now, this awareness has to do with the WHO, the World Health Organization, and then wrapping up the conversation today, MLS Lawal. What would be your best advice, your parting words as a medical lab scientist to Nigerians that are listening at this time, so that we can end the show? But we'll take one call before we go. Hello to you. Good morning. Thank you very much, Mr. Friday. Good morning. How is the weather over there? Thank you. Do you have a question for MLS Lawal? Mm. What question is that? Kashambili. Thank you. Thank you very much for calling. He would attend to your question. Now, what he's saying is this. He's saying that, and this is funny. It might be funny, but I think it happens to some people. They might just think that way, that if I decide to go to the hospital myself, won't they feel like I'm satisfied, Motijan, you like he said, let us talk to us as a professional. How do you guys go through it?
Well, the wellness part, like I will not want to say much, but the person can come and make inquiry. Understand? Because it's a special package. And
under Ilera Eko? Oh, it's not under Ilera Eko.
Under Ilera Eko and other package might be outside, but might be under too. You understand? Well, the details we have people who are in charge. We have a doctor in charge there. Can come around and come and find out what you are going to do. But what I can say about it is it's a special package.
It's a special package.
Whereby you may not have to pass through, all those things too. Is when we say okay, platinum, gold, and all that. So it's category by category.
It's category by category.
So if you want to come and do wellness, we tell you. But if you want to come and check yourself, not just wellness, there is not like nothing like TJOU. Yeah, you see, you do all the tests you want to do for you at the same price with others.
So it's not just that, this one came by himself, or it's not like he's here.
No,
Let us bill him.
We have people that come to the lab directly and say want to do general tests. But because of the hospital protocol, we don't just bring you in and collect your blood and all that. We will still say, okay, try and see doctor. Maybe there could be something you add to the test. So then you come back and we'll do all the tests for you at the same price.
Let me also still add to this, Mr. Friday, if you can hear us, and every other Nigerian listening. One thing I can assure is that the administration of Dr. Taiwo Azan, the Medical Director, General Hospital, is one administration you would admire. For those of you that are conversant with General Hospital Ikorodu, you would agree that things have changed a lot. with General Hospital. If you intend to go there, definitely they would attend to you, and it is not going to be a case of it will not be that case at all. It's very important. Get yourself checked. It is key. It is very, very germane. So before we go, sir, what will be your parting words, your best advice to Nigerians as regards the conversation for today, which has to do with antimicrobial resistance, what they should be doing, what they should not be doing, like you have said before? Let's just have a wrap up of your conversation.
Yeah, well, the parting word and advice to Nigerians, people listening now, is that when you have cause to come to the hospital, maybe you are sick and all that, you follow the proper the right things. When the doctor tells you, do this, do that, follow it. They prescribe for you, follow this prescription. You know, they ask you to go and do tests, go and do the test. You understand? You know, they send you to the pharmacy, go and collect the right drug and all that. You know, so because they are after your well-being, and if you follow the right thing, don't listen to anybody, don't listen to quack. Another problem we have, there are a lot of quack who just want to. When I walk on the road, on the street, I heard a lot of, they will record some certain kind of talk. Staphylococcus aureus, this aureus, and all that. If you are in the board, they will be, telling you all sort of things. The boss, I just smile and laugh. Sabolena, they don't know what have they seen it before in the laboratory. So let's be careful with all this. Let's go to qualify medical personnel, and get them.
Thank you very much, medical lab scientist and Mr. Lawal. The way you ended this conversation is making me remember a lot of things. You will see, they will tell you one drug will work for like 4 things. Especially in these buses they call down for these long buses. They will just tell you this thing it can work for. Thank you very much, MLS Lawal. It's been a very beautiful conversation here at IKD 106.1 FM, as we have talked about one of the key areas toward the World Health Organization, the WHO. Emphasizes on many times as regards antimicrobial resistance. It's important that we stay conversant with these things, and it's important that you get yourself checked. When it has to do with medications, when it has to do with drugs, avoid self-prescription, avoid self-medication. Affect abele, I think that's what they call it, abele doctors or this thing, the quacks. Alright, especially those ones you just see with one small basket, the roundabout, and then they start selling drugs. God bless you, God bless Nigeria, God bless Ikorodu. Health is well. Stay healthy, stay safe. Until next week, Thursday, same time, same station. It's a bye for now.